Welcome, everyone. I'm so excited to welcome everyone to our general meeting, Rooted in Resilience, Fostering Trauma-Informed Sectors and Systems. Before we get started, I just wanted to share some housekeeping. So we'll be using Menti as an interactive tool. You could scan the QR code with your phone, or you could also log in. We'll share that code in a minute. If you have any problems, please feel free to contact Annalisa. You can see her email there. And the recording and the slides will be available on the Resilient Georgia website. So I'm so excited to welcome everyone today. I'm Audrey Cotter, the Director of Regional Programs at Resilient Georgia. My colleagues, Alex English, Nikki Warner, and I support, champion, and amplify our regional coalitions and the impactful work they lead in their communities. It's been a couple years since we have showcased our coalition partners in a general meeting, and we're so excited for them to share their work with you. This meeting will spotlight 5 of our regional coalition partners who are doing impactful and powerful work to create supportive spaces for those impacted by adversity, while also taking proactive steps to prevent adversity and reduce its long-term effects. Their initiatives strengthen the development of a more trauma-informed and resilient workforce, while also advancing more compassionate and responsive systems. We'll be hearing from coalitions from Middle Georgia, Chattahoochee Valley, and the Metro Atlanta area. And when we wrap up the meeting, we'll have a chance to hear from Dr. Andrea Meyer-Stinson, Resilient Georgia's Director of Workforce Strategies and Initiatives. She will share how we can tackle workforce gaps and challenges together. So before we dive into the regional coalition presentations, the regional program team will take a moment to share a bit about Resilient Georgia and the work we're doing across the state. Next slide, please. Resilient Georgia is a coalition of more than 900 partners and stakeholders across the state working to prevent childhood adversity and promote resilience. Through this network of public and private partners, we're developing a pipeline of trauma-informed behavioral health services and resources that support both child and family wellness. Together, we're building a more collaborative, a more trauma-informed, and a more resilient state. The 3 pillars of our work is to convene and connect, celebrate and share innovation, and remove barriers. So our general meetings like today and our virtual lunch and learns are some ways we connect partners to each other. We also work to celebrate the amazing work that is happening across the state. We have research briefs and scans available on our website. We have many resources that list and highlight Georgia-based organizations also available on our website. And this showcase also celebrates the innovative work of our coalition partners. And we work to remove barriers. So this can be big, like advocating for policy change, or small and still very important, like connecting organizations to each other. I'm going to hand off the meeting to Alex English, our regional program coordinator, who will share more about the regional coalitions.
Thanks, Audrey. Right now, we're working with 17 regional coalitions that currently cover 125 of the 159 counties in the state. So that's about 79% of the state, and we're actively working towards full statewide coverage by the end of this year. Each coalition has built strong public-private partnerships and is deeply engaged in efforts to reduce mental health stigma, address and prevent childhood adversity, increase trauma-informed awareness at care, coordinate local systems of support, and build resilience in children and families. They do this through a combination of education, training, workforce development, policy work, and research, and really taking a comprehensive approach to improving mental and behavioral health in their regions. Just as we focus on building connections at the state level, these coalitions are doing that work locally, connecting organizations, providers, and stakeholders within their regions. If you're interested in seeing more of what that looks like on the ground, take a look at the Resilient Georgia 2024 Regional Summary Update Report. It highlights the work happening across the state and the progress that our coalitions are making every day. And now I'll hand it over to Nikki.
Thank you so much, Alex. So our topic today for our regional showcase is about fostering trauma-informed workforce sectors and systems. So let's talk a little bit about what that means and really introduce the topic at hand and why it's important. So today we're going to talk about what it means to become a trauma-informed workforce and workplace. Trauma-informed approach recognizes the whole person. It acknowledges that past experiences, especially those involving trauma, can have a deep and lasting impact on someone's mental and physical well-being, and shapes how someone thinks, feels, and acts in the present moment. That includes how they show up to work, interact with colleagues, and manage stress. This can affect job performance, communication, and even their ability to stay engaged or feel safe in the workplace. So why does this matter, and why is it important to understand how trauma affects both individuals and systems? And why is it important to embed that awareness into our workplace culture? Trauma-informed environments foster trust, safety, and collaboration. They can reduce burnout and compassion fatigue and improve employee mental health and retention. They also lead to better outcomes, not just for the workforce, but for children, families, and communities that we serve. So to understand trauma's impact on individuals is crucial. Resilient Georgia offers a comprehensive training roadmap on our website that outlines these 4 stages that you see here in the graphic of becoming trauma-informed according to the Missouri model. These stages range from becoming trauma aware, which is recognizing the prevalence and impact of trauma and shifts the focus from what is wrong with you to what happened to you, moving towards trauma sensitive, creating a culture of safety, understanding, and respect in the workplace, then to trauma responsive, beginning to integrate that knowledge into policies and procedures. And finally, the last stage, becoming trauma informed, is when organizations have embedded this trauma-informed culture into their organization and practice. By adopting a trauma-informed approach, organizations can prevent burnout and compassion fatigue, create healthier, more resilient workforce sectors, and in turn, recognize trauma and respond with compassion. When we do this, we create healthier teams, stronger organizations, and when resilience is a part of our culture, everybody benefits. So during today's meeting, as Audrey said, we are going to spotlight 5 coalitions who are helping bring trauma-informed initiatives into various workforce sectors and systems. Without further ado, I'll pass it to Amanda Juarez with Resilient Middle Georgia, and she's going to start us off.
Good morning, everyone. Can you hear me okay? Good morning. So my name's Amanda Juarez with Resilient Middle Georgia, and I'm honored to kick today's showcase off on fostering a trauma-informed workforce, What I'll share today is how we're building that workforce, not just through training, but by transforming leadership culture and engagement across sectors, including healthcare, education, youth serving systems, and social services, with a growing focus on expanding into other sectors, including law enforcement, business, and beyond. Now, I'll briefly share how we've advanced this work and how you might adopt this model in your own region. So let's start with how we laid the foundation. Next slide. Now, after years of relationship building in our communities, we asked ourselves a critical question. How do we go from good intentions to sustainable engagement? Now, in 2024, thanks to the incredible work of our coalition coordinator, Doriso Pong, we formalized coalition membership with commitment letters and onboarding materials that clearly outline roles and expectations. Today, we have over 55 official coalition members across 11 counties. The difference in our new coalition onboarding process is that it's grounded in transformational leadership, where members don't just attend meetings, they lead change within their organizations. And the goal is to embed trauma-informed principles, not only in programs, but in leadership culture itself. It is this shift from transactional participation to transformational leadership that is foundational to how we build trauma-informed systems. Next slide. Now, in fall 2024, we launched our first coalition satisfaction and leadership survey, and we received a 43% response rate. Our biggest strengths included empowerment, communication, and collaboration. Members also helped us identify growth areas, like clarifying more specific roles and responsibilities, strengthening connections, and building readiness for policy and systems change. Now, it is this feedback that confirmed our shift towards transformational leadership and gave us a roadmap for what comes next. So when asked what keeps transformational leadership going strong, members repeatedly named collaboration, ongoing training, and active member involvement. Next slide. Now, I'd love to hear from you. If you had to name just one trait or skill that builds a trauma-informed workforce, what would it be? Okay, we have some responses coming in. Compassion. That is such an important trait right now. Compassion, support. Seeing a lot of compassion. Empathy, effective communication, respect. Definitely want to just give a minute to make sure everybody has a chance to go ahead and think about one trait or skill that would build a trauma-informed workforce. Listening. Yeah, I'm seeing a lot of what we heard in Middle Georgia too. We have that active listening, that support, compassion, empathy. So it's really traits like these that are the exact values that we're trying to build across our sectors and our region. Thank you so much for sharing. Next slide. So from turning insight into action, one thing we've learned is that listening cannot be a one-time event. So that's why we've committed to making our coalition satisfaction survey an annual practice to help us track progress and stay grounded in what our members need. So we're using that feedback to shape everything from our strategic planning and training to how we define leadership within the coalition. So we're also exploring peer mentoring and leadership development opportunities for members who are ready to take on more active roles. We're continuing to evaluate how transformational leadership is being applied across sectors. And we're also co-developing onboarding videos that partners can use to embed trauma-informed values into their own systems starting from day one. So it's this big step that's really a step towards making these practices sustainable beyond the coalition itself. Next slide. Now, to recap, through Doris's incredible leadership and the coalition's collective effort, we formalized membership, created an intentional onboarding process, and launched a regional leadership survey. We've taken a strategic cross-sector approach to fostering a trauma-informed workforce, laying the groundwork for long-term systems change. Now, what we're building isn't just a coalition. It's a leadership culture that supports trauma-informed systems at every level. And while we're still growing, our approach is rooted in feedback, accountability, and a commitment to sustainable change. So we believe that when we invest in leadership, we create the conditions for trauma-informed systems to grow, not just within organizations, but across entire communities. Now, our model centers on leadership development, member feedback, and shared values that can be replicated and scaled. So we invite you to join us in building this movement together. And I'll leave you with this. Transformational leadership isn't a position, it's a practice that builds resilience at every level. So I want to thank you so much for your time, and it's now my pleasure to introduce our next presenters, Amani Jones and Rachel Chambliss with Resilient Chattahoochee Valley.
Thank you so much, Amanda. It's great to hear what you guys are doing. I love that. My name is Rachel Chambliss. I'm the Director of Engagement with United Way of the Chattahoochee Valley, and I work with my colleague, Amani Jones, on Resilient Chattahoochee Valley. We are going to share today about a strategic partnership in our region focused on addressing the needs for mental health services and providers through workforce development and capacity building. With United Way of the Chattahoochee Valley, we cover 12 counties in West Georgia, and those counties are we're based in Muskogee County, which is urban, and then some counties that are more rural and have different community needs for service and impact. So Amani is going to take us through a little temperature check before we get started on what we are sharing. Amani, if you want to introduce yourself real quick and share what we're asking folks to share here.
Hi, good morning. I'm Imani Jones. I'm the manager of the Basics in Resilient Chattahoochee Valley here at United Way of the Chattahoochee Valley. And because we believe in tons of social emotional learning, we thought we'd incorporate that into our interactive today. So as you see on the screen, if you were a weather forecast, what would your mood be? And I think mine kind of coincides with what our weather is today, ultimately really sunny with a little bit of a overcast. So as those answers roll in, we'll start diving into our approach into how we as United Way and RCV look at coalition building and how we come to building the relationships we have with our partners. So next slide, please, Alex. So a bit of a background information as you kind of read through some of these statistics on this page. We have joined forces with a local behavioral health specialist or behavioral health institution that United Way has had an extensive relationship with, but recognize that RCV could support through some of their more targeted efforts. So we at United Way operate as conveners and not necessarily direct service providers. So we recognize there was still opportunity for us to have a hand in the efforts that we're working on. So Pastoral Institute is a local behavioral health provider. We have a shared interest in broadening and deepening our trauma-informed care throughout the region, obviously with our efforts attached to RCV. What grew out of several meetings of shared interest developed into us co-collaborating on hosting a teen mental health first aid training. And then with the 3 stats that kind of highlighted for us our need to call to action was that 76% of Georgia's counties are designated mental health deserts, that the youth mental health emergency visit increased, obviously with us serving ages 0 to 26, that was imperative for us to address. And then the rural counties that have an average of 4,000, one mental health provider to 4,000 people. So that's a huge deficit in support. So what happened based off of those conversations is we joined in a grant agreement to offer and support Pastoral Institute with some funding through RCV to touch on our tiered approach that we through RCV report on to Resilient Georgia to include prevention and intervention services, research evaluation, community outreach, policy systems and environment changes, and training and education.
So as Amani said, when we were looking to develop this partnership, we had some specific objectives. And we wanted to make sure that those objectives met all of the approaches that Resilient Georgia looks at in terms of creating trauma-informed communities and spaces. And we feel like these objectives here really helped us to meet each of those different approaches. Again, important on here, ensure mental health services are culturally competent. Important in our region too, because we are covering different spaces and different counties with different approaches. Also, the telehealth and access to mental health services is important and different and varied based on our communities. So these are the objectives that we entered into this partnership with. Amani's going to share a little bit more about what the scope of that partnership really looks like and the tangibles and deliverables that are going to come from that. We're excited to see it move forward. Next slide.
So Rachel touched a little bit on some of the efforts and overview of programming that we've gone into agreement with for Pastoral Institute. And so reminder, we are operating as conveners and not direct service, which helps us with capacity building, but also allows us to leverage relationships that we already have throughout the community. So as you see on the screen, there will be an offering of telehealth certification for 3 APCs to reach a broader community, which includes our 11 or 10 county rural footprint, workforce wellness, that also includes us in some capacity since we already receive services, but ensuring that the that staff that work with students in our rural schools are mentally healthy and well to operate at their full capacity. One opportunity that I would really like to highlight is the partnership with Brewer. Brewer Elementary is now known as Early Innovation Academy. It is the first in the state, an academy that looks at focusing on K through 12 students or K through 2 students isolated to address behavioral health issues and underperforming students to kind of get them at that catchment area before standardized testing begins so that they are on grade level with reading and all other performance areas. And through that partnership, PI will be offering for identified students whose family and themselves will receive wraparound services and therapy sessions to address some of the underlying issues that might exist. They will also be offering and learning in the second part, the EMDR therapy training. So eye movement and desensitization reprocessing therapy. It is a form of holistic and trauma-informed therapy to kind of look at the ways the eyes move when somebody feels stuck in a PTSD sort of state. This research piece includes a book study to review for 3 residents and 3 interns. So while the workforce development piece, looking at ways that they can broaden the opportunity to put mental health providers in more rural spaces. So the physical and the tech piece of it. And then also the addressing of the Hope Fund, which would offer 12 sessions to underserved burden clients that participate in supports through PI. Next slide, please.
Damani, I just wanted to maybe
Sure.
to go back to that slide real quick, sorry. Go back real quick and touch on the 2 other offerings through the scope of this partnership. That book study review, it was an important part to add in there so that we are increasing awareness and education and empathy through some of those different through different means for counselors who are acting in the community. And then the last of those there, the Hope Fund is provided in an already existing program, and we're able to plug into that with this partnership as well to be able to provide some additional needs support for through at least 12 sessions in the community. Again, this is work that's new and the idea of capacity building for our region in terms of counseling services is important. And as Amani mentioned, that Brewer pilot program is something that we're excited to see happen this year and potential for scaling up to other areas as well. Now, next slide. And just a few other things to touch on anytime we're entering into a partnership or agreement. We are very specific about the timeline for those deliverables and the data collection that comes from that. The data collection, each of those different areas of scope and work will have some data, whether qualitative or quantitative, with surveys and things like that that will come with that. So we'll be able to share that with the larger group and with Resilient Georgia to help move everyone's work forward. The other important part is that continued leveraging of our coalitions. As Amani said, we are not the service providers, but rather the conveners of that work. But we will play a part in connecting Pastoral Institute to connections and groups out in our rural areas to continue this work and move it forward. Amani, is there anything else you wanted to share as we kind of wrap up what we're sharing today?
Nope, I think that's it for me. And we have the pleasure of introducing Shape Peoples. Thank you.
Good morning, everyone. So my name is Shay Peoples. I am the project coordinator for EXERI, now known as Resilient Clayton. I serve as working in the Clayton County area where we address trauma in the Clayton County area. So I lead all the initiatives as it relates to trauma in the Clayton County. You can go to the next slide. So I will be talking about basically how are we fostering resilient educators through healing circles. And many people may want to know like exactly what are healing circles. Healing circles are basically birthed out of the Native American spaces. And we have seen many indigenous countries basically utilize these spaces or circles as a way to address complex issues within their community and or village. The healing circles create a safe space for individuals to come together and interact with one another and basically find some common ground, knowing that maybe other individuals are sharing some of the same experiences that they may be experiencing. As adults, we were actually, when we were going into the schools and we were sharing ACEs training, we realized that the teachers or the educators, there was a need for us to address what the teachers were going through, or what they may, that they needed a space to kind of release. So with our healing circles, we call them agentic healing circles, which basically just gives individuals who are in the circles agency to share and to be vulnerable regarding their thoughts and emotions. And those that are in the circle had the opportunity to truly connect with one another, just to see someone who may step into the space, maybe kind of antsy, or, you know, coming into the space maybe because they were told to, but to see them kind of relax and honestly get to, you know, just to relax and kind of begin to share and open up. It's been great to see. So the agentic healing circles, they curate a safe space where participants can share their thoughts, feelings, and emotions. The circle is designed to promote a sense of comfort and protection. And often in vulnerable spaces, it's a way for them to share their experiences. The circles catalyze emotions and healing as well. So one thing that we want to do is basically kind of just hear from you. You know, when a leader or an educator is healed or healed, what are they able to do? When a leader are healed, they are able to do what? Yes, show up as their best self. Absolutely. Serve. I love the serve, that lead. Great. Not be so defensive. Absolutely. Absolutely. Support others. Show up as their best self. Servant leadership. Connect. Lead effectively. Heal others. Absolutely. When leaders are healed, they can step into the space and kind of ask those pivotal questions that could, you know, understand another individual versus making assumptions. So basically, healing is definitely important. We have a saying in our organization is, we can't heal what we don't acknowledge. So we have to acknowledge that even as educators, there are things that we may experience or that they are experiencing that they too need the opportunity to release so that they can show up as their best self. So I absolutely love it. I love them. So what are agentic healing circles, or why? Why agentic healing circles? And most importantly, why do we choose teachers? Basically, we know that teachers and childcare providers, they have life experiences that inform their interactions with children and the youth. And so if we could basically grab a hold to this group of people that are dealing directly with the youth and help them heal so they can honestly show up as their best self, why not? Modeling vulnerability while promoting self and encourage participants to share their struggles and their triumphs is honestly amazing to see. Learning about each other in this intimate space allowed educators and providers to humanize their colleagues and see them differently. We have many organizations that utilize healing circles as a way to team build. We have organizations that have basically asked us to come and perform healing circles on a quarterly basis as they are getting new employees, or they may have gone through a little some triumphs or some trials and tribulations within their organization, and they just want us to kind of come in and help them kind of debrief. It's been amazing to see. Sometimes throughout these healing circles, other colleagues are truly able to learn one another and understand one another as far as how someone may act, or why someone may act the way they act. So it's great that these healing circles provide that for the participants. Participants have reported feeling more self-aware And the sense of awareness made participants feel empowered and gave them a greater sense of agency. So oftentimes after leaving the healing circles, we've had many educators and childcare providers, by listening to their colleagues, help them to turn inwardly and examine themselves to say, you know what, I'm going to take agency over this particular thing that I may do, that I can go back and be my best self, which has been amazing to see. Agentic healing circles for educators. What we are doing next, we're looking to develop an evaluation protocol that allows us to qualify and quantify the value proposition of the work over time. We want to leverage the experiences of others using multimedia platforms to raise awareness of the work that we're doing, and engage more schools and childcare providers throughout the region to adopt agentic healing circles as a wellness resource for staff, and also use healing circles as an entry for ACEs education and or vice versa. So if those who are interested in healing circles may, we can go in and perform the healing circles, but then we can parlay that into doing the ACEs training, being able to talk about the adverse childhood experiences, which again, all kind of go hand in hand with one another. So overall, basically going into the schools and dealing with the educators, helping educators basically heal from what they experience daily. We know that educators carry a large load, you know, with dealing with the teachers and the parents and just the demands of their job. This has been a great release for educators. And oftentimes when we go into these spaces, we may go in wanting to do it with the teachers, and then the administrative staff say, hold on, wait a minute, we need one too. Or we want to, people have asked that we do it by grade level, because the need to be able to address different issues is definitely important in the space of being in the education field. So it's been a great experience, and we're looking to see this work grow in the future. So the next steps, if you want to know more, but one thing I want to say is Javon has a saying, and it's, the hands that shape the lives of our children daily must themselves be healed at times. And I think that's important as we go into different spaces, and especially dealing with educators, that educators are human and they carry a load and themselves need to be healed. So it's been a great experience, and we're looking forward to what's next. And I have the pleasure of introducing Leslie Sanders with the Cobb Collaborative.
Thank you, Shay, and I love that explanation there. Thank you so much. Good morning, everyone. I'm Leslie Sanders, the Mental Health Program Coordinator with Cobb Collaborative, and we at Cobb Collaborative engage, educate, and empower the community to improve their well-being of children and families. So today I'm excited to share about how we're working alongside local courts and community partners to really build this trauma-informed workforce and ultimately a more resilient Cobb County. So our most robust example comes from the Cobb County Juvenile Court and our partnership with them. So in 2019, Mr. Adolphus Graves became the court administrator. With his support, the Cobb County Juvenile Court system embarked on a plan to prioritize a trauma-informed setting. So that decision has really blossomed into a strategic, ongoing partnership, which has in the past 3 to 4 years included various different trainings, events, resources provided, and action items planned to continue this focus on a trauma-informed system. We even had a cross-disciplinary panel of 3 leaders that participated in our very first Resiliency Cobb Summit in 2022. So as far as the trainings go, Cobb Collaborative has provided Connections Matter and the Community Resiliency Model, which both are trauma-informed trainings focused on increasing awareness on how stress and trauma impact us and the tools we can implement to grow our resilience. So these trainings worked great in tandem with us establishing a resiliency resource station in the juvenile court, which is really a calming, resource-rich space for staff, youth, and families. And the station has many different types of resources, both tactile and print, really focused on the wellness and self-regulation strategies. So yes, thank you for putting up the mentee question. So I'd love to hear from you. Have you ever walked into a government or public service building and felt safe and comforted? Kind of what are your feelings around that? Yes, seeing mostly no's and rarely. Sometimes. I think it depends on the building, right? Yes, rarely. So we can see that most often these buildings are not designed with the thought of bringing calming, comforting sensations to individuals that walk through the halls. They are obviously designed for their purpose, but really that environment can impact a person who is experiencing trauma and seeking support from whichever way in the court system. So our court system doesn't just talk about change, they live it. So one day a few years ago, after the courtroom floors had been freshly painted, the court administrator, Mr. Graves, reached out to our executive director with a question. Could we help brighten the halls with art? So this conversation grew into something really meaningful. Rather than just showcasing art from Cobb students, we asked what if the youth involved in the court system programs could also participate in providing the art themselves. So we ended up partnering with Paint Love, a wonderful organization that brings arts programming to youth facing poverty and trauma. And they're all about empowering youth through creativity, which is what the goal of this project was. Through a multi-part series, Paint Love came into the courts to guide youth through different trauma-informed art sessions. So these weren't just kind of arts and crafts activities, they were opportunities for healing, for creative expression, and for these young people to see their own art displayed in the very space that's giving them that second chance, that healing supported, resiliency-focused environment. So our partnership with Paint Love continues to this day and really has enabled us to integrate more creativity into many areas of our work. So while the juvenile court has been a flagship partner, this work is growing into Cobb Court systems overall. We've brought CRIM to state and probate court staff, as well as CASA volunteers and staff. And we're collaborating with the district attorney's office with hopes to lay the groundwork for something bigger, making all of Cobb County legal system trauma informed. And in January of this year, Cobb Superior Court became one of the first in Georgia to adopt the mandated Student Attendance and Climate Protocol Committee. Our Director of Strategic Initiatives and Partnerships, Caitlin Ball, represented us at the signing ceremony, and our Executive Director, Irene Barton, now serves on the subcommittee. So we really believe that our trauma-informed programs and environmental projects will play a critical role in this effort. So you can see the numbers here, but in total, we've trained 129 individuals, both staff, youth, CASA volunteers, and family members in trauma-informed models. So this includes those 58 attendings in the juvenile court with CRIM and Connections Matter, trained 33 state and probate court staff with CRIM, 25 CASA volunteers with CRIM, and we just this year launched our first joint CRIM session with families, youth, and their parents, totaling 13 individuals. And as Janessa Nair, the court support manager from Juvenile Court put it, without COB Collaborative, there is a strong likelihood these resources would not be functional for our youth and families. So this really tells us that we're not just checking a box, we're helping to fill a gap. Really building that trauma-informed workplace that's not just about professional development. So as far as, you can go to the next slide, please. Yes, community resiliency model, thank you. And as far as what those next steps are, we're finalizing an MOU to make CRIM a recurring support for court-involved families. So this year we plan to expand to Spanish-speaking families. It's a large population in Cobb. We have a contracted partner that we have ready to step in and help us. We would love to continue staff and youth wellness resources. We are in talks of developing resource bags for those youth and really deepen a system level conversation on becoming trauma informed and what that looks like, what that change and process looks like. So this work is ongoing and really grounded in the belief that trauma-informed systems don't just help people cope with whatever they are going through in life, they help people heal. And you can go to the next slide. We'd love to connect, and we have many ways to do that. You can visit our website, cobcollaborative.org, or sign up for a newsletter. We have 2 different kinds of newsletters. Or just reach out to either one of us on our team. We're always looking to collaborate in many different ways. And we would be thrilled to talk more about the work that we do in improving the lives of children and families in Cobb. And to close, building this trauma-informed workforce isn't just about professional development, right? It's about changing those systems and changing lives through that trauma-informed and resiliency-focused support. So thank you guys so much, and I'd love to introduce Aviva Berman and Aisha Williams from Atlanta Regional Collaborative for Health Improvement, or Archie for short. Thank you.
Thank you, Leslie. Love your work. I'm excited to follow along. Good afternoon. I'm Aviva alongside Aisha. I'm a Senior Innovation Manager here at Archie. We are round 4 grantees, and we're here to talk about the proof of concept that we've created here for a more person-centered system of care. And then our Menti question is, what are your pain points for accessing care? It can be so difficult even for resourced, educated, connected people to access care, but more so for those who are marginalized, forgotten, systemically, discriminated against. So think about, your own care plan, your care team, and what does that look like for you, the pain points that you may encounter. Seeing a lot of long wait times, lack of coverage. I just got a bill for my annual physical. I thought preventive care was free, but limited providers. Yes, there is a desert of providers south of I-20 in the metro area. Cultural competency is huge. Of course, transportation in the metro area is always something. Stigma. Yes, these are really thought-provoking answers. Thank you for contributing. And with all of this in mind, this is where Archie kind of came in. So to remind folks or to reintroduce ourselves, we're the Atlanta Regional Collaborative for Health Improvement, and we are a neutral convener in the metro area to bring folks together to invert the burden and create and improve health outcomes in many different ways, in many different programs. We've been around for over 12 years now, and we are so proud to be a grantee of Resilient Georgia. So Aisha, if you want to kick us off here.
Yes, thanks, Aviva. So again, our community resource hub model is focused on alleviating the burden of accessing care for people that have chronic conditions and social drivers of health. And our goal is to improve their health outcomes by addressing those social needs. And so, as you all just kind of indicated in the Mentimeter, and we have depicted here, the burden of navigation falls heavily on the individual or the family and the staff working to support them. It's oftentimes, not a straight path to being able to address services and address needs. And sometimes there's the challenges or the roadblocks of eligibility, accessibility, the administrative burden, transportation, the stigma, and just even the time and the process and the service availability. And so we have created the community resource hub model. And next slide, I did not, for some reason, I'm not able to advance. Thank you. Creating a person-centered model of social, physical, and mental care. And so Archie created the Community Resource Hub model which employs trauma-informed tactics by connecting people to health and social care resources needed for well-being and better health. And, we are focused on utilizing those trauma-informed principles of safety, trust, choice, collaboration, and empowerment. And by addressing people's social needs in addition to ensuring that they are connected to affordable health care, our communities.
Aisha, I think you cut out, maybe just for me.
Yeah, I'm sorry. I lost, something happened there. I don't know if it was the internet or what. I'm sorry about that. Can you all hear me now?
Yeah, you're good now.
Okay, sorry about that. By addressing people's social needs, in addition to ensuring that they are connected to affordable health care, our communities will have better overall health and reduce chronic conditions. Next slide. And so, we are, focused on the Community Resource Hub is a real-time closed referral network that facilitates coordination and data sharing among clinical providers and community-based social service organizations. As we mentioned, it's really focused on addressing those social drivers or social determinants of health. And we have community-based partners from all throughout the Metro Atlanta area focused on education, access, and economic stability, work programs, job training programs, the social and community context, neighborhood built environment, and healthcare access and quality. So we really are trying to make sure that we are able to address a variety of needs for the patients that we serve. I'll turn it back over to Aviva.
So to advance this work of creating a person-centered model, we've seen wonderful results from the first few years of piloting this model. We've continued to expand who our partnerships and our funders, our interested funders, and we're getting creative with who we're working with. We're able to expand these hubs, not only just stemming from medical systems, very strong partners in the metro area who are interested in working with us. But now we're looking strategically into neighborhoods. Where are communities? Where have they been redlined? Where have they been strategically and systematically, discriminated against and marginalized? How can we support them by making this a more person-centered approach to ensure that they get their social and physical needs met? So we're excited to be expanding into these neighborhoods and into these strategic communities to better support our residents. And excitingly, we also are a big planner and supporter of the Community Health Worker Summit in June. That will take place, I believe. Aisha can give more information on those details, but we are able to convene community health workers, employers, and allies from all across the state every summer. We typically get around 100 to 200 folks gathered for a full day, and it's a wonderful event to really re-energize our network. But looking ahead, we also are creating a portal to better optimize the interoperability between all of our partners and our clients as we assist in distributing this care.
Thanks, Aviva. And just a few more highlights on the Georgia Community Health Worker Network. Again, Archie does serve as the technical assistance and provider for the network. And so we're excited to just continue to be able to help build capacity for this workforce. So CHW Network serves as a professional network for CHWs in Georgia, and we work in collaboration with the CHW Advisory Board and the CHW Advocacy Coalition. Many of you may be familiar with the Advocacy Coalition, which is led by Georgia Watch and Natasha Taylor, and they are really, critical in our work for advocacy and introduced legislation this year, House Bill 291, to help advance statewide certification for CHW. So real critical work that we are doing and continuing to work on. Even though it did not get passed this session, we were really close. And so we're looking forward to having that passed next year. The network assists with messaging about the community health worker workforce and ensures that CHWs are represented and accounted for and connected to statewide, regional, and national resources. And we provide recommendations and guidance on the development of the CHW career ladder. And we'll be making that recommendation at the summit this year. And then we're also working in collaboration with other partners to educate employers and supervisors around the role of community health workers. Recently did a presentation yesterday at the Georgia Primary Care Association Conference. You can find more information about the Georgia CHW Network at gachw.org. And you can also please make sure, share this information with your networks. We'd love to expand that network and have more people join.
Thank you, Aisha. And yeah, please stay in touch, subscribe to our newsletter, attend our April 30th breakfast. We are proud. One of the best parts of this job is putting together our quarterly breakfasts. Every quarter, we put together a different theme and we bring in subject matter experts. We have a panel, we have table time, networking, of course, free breakfast. It's always in a convenient location, free parking, close to MARTA typically. And our next breakfast is next week on Wednesday, and we will be tackling the conversation on centering the conversation on hypertension, best practices, and how to really care for folks who have it. So we hope to see you there. And then thank you again for your time and for Resilient Georgia's support. And it's my honor to introduce Andrea Meyer-Stinson. Thank you.
Thank you, Aviva and Aisha, and everyone who's presented before. I just want to take a moment to acknowledge all the amazing work that we have just heard about. I know they had limited time, but I just want to lift up each and every one of those regional coalition chairs and just, I'm so honored to be able to know and support the work that you all are doing. So thank you. I'm Andrea Meyer-Stinson. I'm the Director of Workforce Strategy and Initiatives, and my time at Resilient Georgia has been varied, and I've been here since the beginning, and I'm just really honored to talk a little bit more today about the state of workforce across Georgia and some strategies that we are using and can use both at the state level and at the regional level to improve our workforce issues. So many of you have probably heard the statistic, and it changes year to year, that Georgia ranks consistently pretty low in the nation for access to mental health. Resilient Georgia is committed to changing that and working towards systemic change to address that issue. As you've already heard today, our regional coalitions are doing that work and have been doing that work since the beginning. And I just want to point out that one of the 5 pillars of Resilient Georgia's work is workforce related. Probably should have asked for that to be at the very first slide, but as a wrap up here, as a reminder, Resilient Georgia's second major pillar is to advance workforce through recruitment, retention, education, and development. And as you can see, and the statistics here provided that we are still struggling to meet the mental health needs of folks across the state. Obviously, we have a lot of challenges that have been identified today and a lot of potential solutions, but we also have a lot of work to do. Georgia has a significantly high number of mental health professional shortage areas. As you can see in gray, it is, I think, 94% of our state is identified as a mental health professional shortage area. And I would guess, even if you ask those people in the green or blue areas, which some of us live in, do you feel like you have access to mental health care? I think you would still get an answer of not really, or it's really difficult to access. So this is something that we are addressing and working on in a variety of ways, both through our regional coalition work and at the state level. And I'd like to take a minute to share that information and talk about both things we have been proud to see happen, but also things that Resilient Georgia are working on actively. So when we talk about changing the workforce, we have to think about it in several different ways. One is, through the prevention and education work that the regional coalitions do to advance the trauma-informed workforce. And as you heard today, we're talking about teachers, we're talking about community health workers, we're talking about mental health providers, juvenile justice systems. And as we add more trauma-informed care approaches to those sectors, we are addressing workforce gaps and challenges because our mental health system cannot only function off of mental health providers with licenses. It has to include a base of mental health workers that go beyond the graduate or license level. So I'm going to talk a little bit today about 4 areas that can help address workforce gaps. We can do that obviously through increased trauma-informed care training and education, but there are also other strategies that we can use. So the first I want to briefly touch on are policy and funding solutions. This includes things like expanding loan repayment and incentive programs, broadening reimbursement models, and expanding scope of practice. And I just want to mention, I'll put in the chat that there are ongoing processes happening at the state level to expand loan repayment and incentive programs for mental health providers. And in the chat, I think they're going to put 2 examples of that. One is the Behavioral Health Professions Service Cancelable Loan Program. This is new. It's only about 2 or 3 years old, and many people are not aware of this. Graduate students attending an eligible private or University System of Georgia institution enrolled in an eligible behavioral health advanced degree program may qualify for this assistance. This includes clinician and mental health providers as well as psychologists and psychiatrists. There is also just last year opened up a new Georgia Behavioral Health Provider Loan Repayment Program. This is a service cancelable loan of up to $150,000 to mental health or substance use professionals to repay outstanding educational debt in return for practicing in Georgia. So just in the last 2 to 3 years, we have added a program for graduate students and a program for post-grad in order to help reduce some of those loan payments that they have. Other examples in terms of policy and funding solutions, we know that the Department of Behavioral Health and Developmental Disabilities has undergone rate studies in order to look at reimbursement for mental health services and rehabilitation services. In January 2024, federally, we know that Medicare was expanded to include professional counselors and marriage and family therapists. So this has also been expanded across our state. MindWorks and Resilient Georgia are actively working right now towards statewide initiatives that support integrated behavioral health care, particularly for pediatric populations. We also know that counseling and MFT professions have undergone some licensure changes at the state level. Hopefully that will make it easier to become licensed. LPCs have joined an interstate compact, which allows them to work across multiple states. And MFTs have passed laws that have improved reciprocity, which means it's easier for others to get licensed in Georgia if they already have a license in another state. In terms of education and training pipelines, we want to think about expanding clinical training opportunities, fast tracking and upskill pathways, and supporting diversity and inclusion. And I've heard some folks already talk about these today, but I'm just going to highlight a few things that are ongoing in Georgia in recent years. Last summer, we know that a mental health pathway was added to the CTAE, which is the Career Technical and Agricultural Education Department for Georgia high school students. What that means is there's now an opportunity to start the mental health education pathway in high school in Georgia. If you're interested in learning more about that, please contact me. It is dependent on the school system of that county. So if the school system has not adopted that pathway, you all might be able to help make that happen. We just heard from Archie about community health workers. I was just informed the other day that there's ongoing work to add community health workers as a billable role in DBHDD, which would be amazing. And last year we had a state plan amendment where peer support specialists were added as a billable role for our federally qualified health centers. So that's FQHCs. And I want to really highlight one of the education and training pipelines that Resilient Georgia has been essential in the past 2 years. Myself and my colleague Yasmin Atamna are the workforce team, and we've been working diligently with support from Kaiser Permanente and the National Council to implement the NMWAC, which is the National Mental Health Workforce Accelerator Collaborative. On the right, you can see a map of our NMWAC program sites. This includes 29 sites, 33 postmaster's candidates, and 16 pre-master's fellows. And this Workforce Accelerator project that Resilient Georgia has been implementing across the state, we've been able to really support the retention and education and professional development of new clinicians who are working towards licensure and upcoming mental health providers who are completing their master's degree in one of the 3 mental health disciplines. And what I'm really, really proud of with this Workforce Accelerator project is that our sites are located in 78% of Georgia's professional shortage areas. And we've received really, really high evaluation scores in the implementation of the Workforce Accelerator program. If you'd like to learn more about the Workforce Accelerator program, you can find it on our website, Workforce at Resilient Georgia. And we're really, really happy about the work we've accomplished there in the future that we hope to continue to accomplish. Thirdly, I want to talk a little bit about leveraging technology and innovative models. This was mentioned briefly, so this previously, so this could include telebehavioral health expansion. In those rural areas, it's still really hard to access internet and Wi-Fi. So working towards that is really important in rural and underserved areas. Again, I want to highlight innovative models include more use of community health workers and peer support specialists. And I think Archie and others have done some amazing work in this area. We know, as was mentioned by Aisha earlier, that legislation was introduced and got halfway through the process to create a certification program for the state's community health workers. And just mentioning briefly, Emory, Morehouse, and the Georgia Department of Public Health all provide community health worker training, as well as Georgia Watch overseeing some of that legislative work, and Archie overseeing advocacy and support efforts. So we have a lot of expansion of behavioral health workforce happening already in Georgia. There's also, supporting collaborative care and integrated models, which are innovative models for mental health providers in Georgia. This includes examples of Resilient Georgia has been working with the Collaborative Family Healthcare Association to identify how to better integrated behavioral health into our state. We know that the collaborative care model codes for billing have been activated in Georgia, which means that now primary care providers can use those codes if they use the collaborative care model. And also with Georgia Appleseed, the Carter Center and Voices for Georgia, Resilient Georgia has been supporting the implementation of school-based behavioral health care across the state. So those are all examples of innovative models where we can reach children and families where they're at instead of asking them to come to us. Finally, I just want to mention organizational and systems reform. These are things that I've mentioned examples of already, but includes improving workforce retention, offering support, supervision, and remote working options to our mental health workforce, addressing burnout and secondary trauma with organizational wellness programs. This is a key area where our regional coalitions can do transformational work to really address the burnout and secondary trauma of mental health providers, can help retain more mental health providers over time. Our Workforce Accelerator project has also been key in providing support to new clinicians and up-and-coming clinicians so that they do not have burnout before they start becoming mental health providers. We can also work on systems reform related to streamlining, credentialing, and onboarding, standardizing processes for reciprocity and licensure across state, which I mentioned earlier is already happening in Georgia. This is happening for LMFTs and LPCs, and hopefully also there's an interstate compact happening for school psychologists. I'm not sure if that went through legislation this year, but I know it was up for legislation. So in terms of workforce, there's a lot of work to do, and we are doing a lot of that work. As you could hear today from all of our regional coalitions and from the workforce team at Resilient Georgia, we are being creative and finding ways to collaborate and reduce barriers and come together as a state and as regions to address these workforce gaps and challenges. It did pass. Oh, that's lovely. I'm just looking at the chat. Yay, that passed. Next slide. All right, I am here to wrap up as the MC, so I would like to ask you all, formally invite you to save the date for our next regional general meeting, our next general meeting, which will have a regional showcase on November 13th, 2025, 11 a.m. to 12:30 p.m. Please join us. Next slide. As always, we would love your feedback. We're ending a little early, so hopefully y'all will have time to provide feedback. If you could please scan the QR code and complete a brief survey. We love hearing from you all. We're so grateful for your support and your ongoing, energy that you give towards the work that we do. And we could not do this work without everybody here. So please give us feedback and please come to our next meeting in November. We're so grateful for all of you being here today. On behalf of Resilient Georgia, thank you for attending our session, and we look forward to working with you more. Thanks, everybody.